Thank you for tuning in to Dear Momma podcast, part of Airway Circle radio station. This is episode 7, and I am your host, Dr. Catherine Murphy. Today, I'm excited for our guest, Laael Johnson. She's a dental hygienist, orofacial myologist, and founder of Facial Connection. So let's set the stage with the following quote. Fight for the things you care about, but do it in a way that will lead others to join you. Ruth Bader Ginsburg. I chose this quote and our guest because she truly fought for her son's health and is supporting others to do the same. So welcome and get ready. She's got a great bio. She started as a dental hygienist 13 years ago, and over her 13 years as a dental hygienist, she's had the opportunity to help new graduate hygienists transition from hygiene school into real-world dentistry. She helps her community elementary schools by offering oral health presentations, continue her education into the field of orofacial myology, and bring awareness for the importance of airway health starting from prenatal dental care. Laael is the owner of Facial Connection, an independent orofacial myofunctional therapy practice in upstate New York, where she sees patients both in person and virtually. Laael completed introductory training in orofacial myofunctional therapy from the Breathe Institute's Myo Mentor program. Then she continued to graduate with honors from their most advanced 9-month program in orofacial myofunctional therapy through the Myo Masterminds. Laael continues to collaborate with the Breathe Institute and her fellow mastermind graduates. Currently, she's in the process of becoming a lactation specialist by taking courses through LER, which is Lactation Education Resources. Laael was able to become one of the first members of the Airway Circle team, where she served as a collaborator, moderator, and mentor to their members, which we very much appreciate. She was also able to bring more professionals into Airway Circle for education and collaboration purposes. Lastly, and most likely most importantly, Laael is mother to 2 young boys, ages 5 and 7. It is her children that brought her into this educational journey of airway health, tongue ties, and myofunctional therapy. So thank you so much for being here today. Thank you for taking time out of your schedule. So let's get started with, can you tell me about the path to starting your own myofunctional therapy practice?
Yeah, it actually started because a coworker of mine, another therapist or another hygienist, she lived on the West Coast, and she would come home every Christmas to visit, and we would get together for the holidays. And she had said to me, we had been talking about my son, which we'll get into. And she said, "Have you heard of myofunctional therapy?" And I said, "No." And of course, being the educational guru that I like to be, I had to look into it. And that's where I started my journey with Sarah Hornsby's Myo Mentor program. And through that program, just kind of led me down the path of learning more, trying to incorporate more screenings into the dental practice. And that was going really well. So I started my own myofunctional therapy practice, collaborating with a lot of dentists locally and across the US.
So what got you interested in the dental field to start with?
Oh my goodness. I don't think I have a romantic story for that. I think
that's
I
okay.
really don't. I think, maybe I never had a cavity as a child. Maybe that's why. I actually, within the last 6 months, have really discovered a lot about my own issues that I have going on. And I think maybe the universe pushed me into that at a young age to be where I am now on this trajectory. I'm not sure. No, it was kind of on a whim that I chose dental hygiene for sure.
Okay. Well, sometimes the universe takes us to where we're supposed to be.
Yes, exactly.
So can you tell our audience, they might not know all the training that goes into becoming a myofunctional therapist, and you've gone through some incredible training. Can you tell us a little bit about how intense those programs are and what's involved?
Yeah. So, obviously you go to dental hygiene school, so you have a college degree, and I think dental hygiene sometimes gets looked at as just you're cleaning teeth, and it's so much more than that. That's
for
whole
sure.
nother ball game if you're really into, looking at oral health, finding out why things happen in the mouth, the connection to the body. The mouth is the gateway to the entire body. And so you really have to have a basics learning of all of that before you even get into myofunctional therapy. Sarah Hornsby's program was an intro program. So that was 12 weeks long, meeting twice a week. And then, of course, the collaboration just continues, webinars, things like that. And then I entered Myo Masterminds, which is a 9-month kind of residency program, very advanced in the field, looking at the whole body from physiology to breathing, sleep, tongue tie, just a very much more in-depth view of what we're looking at. And so that was 9 months long. And I did get honor roll for that course. And
or maybe was it Lauren that got it?
Yeah, they did spell my name. They're gonna be so mad if we're talking about that. They did spell my name wrong, but I got a correction one and a nice round of applause from them.
I had to say, for those that didn't see her post, so I was so excited. She posted the certificate of this award. I didn't look at the name. I thought she was just so happy to be presented with honors. And then she's like, oh, but look at the name. I'm like, oh no, they put Lauren instead of Laael. Oh, so don't be mad, Breathe Institute. This is all in
my
good
name
fun.
is very difficult, and I don't take anything too seriously if anybody were to know me. But yeah, so now I'm actually doing their residency in myofunctional therapy masterminds again from kind of a student liaison background. So I'm there helping to answer questions, kind of helping with behind the scenes, some study groups that we're doing, and just really trying to continue to collaborate and push the field further on a cohesive kind of basis.
Now, I help teach the hygiene students. I'm not sure if you know that, on the clinic floor. And so I would like for you to share with our audience, did you receive any training in your dental hygiene program about tongue ties, the connection between mouth breathing and overall health, other than, the puffy gums and mouth breathing, but what kind of education did you get regarding tongue ties, mouth breathing, etc.?
I think there was one sentence in a gigantic textbook about the tip of the tongue being connected to the floor of the mouth and be on the lookout for speech issues. That was it 13 years ago. I know that actually they're starting to incorporate this more and more into dental hygiene schools. So I think that's great. It's now in our scope of practice, which is amazing, but you have to continue your education, at least to be screening and then referring to the right providers. You don't have to become a myofunctional therapist, but to be able to check the boxes and really understand early intervention from your pregnant patients all the way through when they have their babies. So,
and to know when to refer. I just find it really important for our listeners to know that most dental hygienists just are not taught this. It is just not taught. I'm very honored that currently, as an adjunct faculty, I can talk with the students on the clinic floor. I can talk with them when I'm a guest lecturer, but to understand that it takes a long time because of accreditation, and the schools have so much put on them for accreditation that this really is something that is slowly getting infiltrated by those like Laael and myself going into the schools and talking with the students. So I appreciate the school letting you do that.
Yeah. And, there's only so much that you can teach in dental school. You need education. Dentists need more education. Orthodontists need more. We all need more education. We practice medicine. That's to continue learning. If we knew it all, how would we ever advance in any medical field, let alone something like tongue ties?
Exactly. So we mentioned your sons. Would you like to start letting us know a little bit about the background of how you really connected everything between your friend coming home from the West Coast, talking to you about it, to seeing this in your son and now to yourself? I'd appreciate it.
Yeah. So I was actually thinking about that before we started, before we hopped on here. And I had done an interview with Sarah Hornsby. I think it was 2019, maybe during Mouth Breathing Awareness Month. And I
Oh
was
yeah.
talking about his case in tongue tie. And um, how much 19, 20, 3 years later, how much even that process has now evolved too. So right from infancy, he had a lot of trouble latching. It was extremely painful for me. Um, I don't know how we made it through 2 years, but yeah, and nobody ever screened him for tongue ties. You'd go to the pediatrician and they would just kind of like put him on, and then he
Mhm.
would magically eat perfectly for them. And then you would leave and you would still not be knowing what you're doing. So then you feel like it's you, and it just kind of snowballs into causing you more anxiety that then gets passed on to the baby as well. But I remember having mastitis. I remember my mom coming over, it was Mother's Day, and I'm like, Mom, feel over here. This is like hard and red. And
Oh
she's like, you have
goodness.
to go to the doctor. You have to go to the doctor. And of course, you put it off. And then finally
Mhm.
I went, and, it turned into an abscess and I had to have
Um,
surgery and all of that because he never fed properly. His
mhm.
lip had never opened to get a full latch. He would fall asleep at the breast.
Yeah.
He would eat, fall asleep. All my friends were laughing, you're nursing all the time, but I was nursing like all the time.
Yes.
And I'm a go-getter, so like I wasn't gonna stop. How I even looking back, I try to think of memories, and I almost feel like you get robbed of creating these beautiful memories that I don't have because all I can remember is going into the OR or having
Oh,
pain. And yeah.
but for 2 years though, is that correct?
2 years we made it, and he got it better. I mean, he began, as we all know, maybe we don't all know, but we begin to compensate. So we find
Mhm.
ways for our body to make things easier. And so eventually he started nursing what I thought was better, but really maybe I was just used to it. Right. Um, but yeah, and then he evolved into a toddler with sleep disordered breathing and breathing issues, chronic congestion. And we saw ENTs that kind of gave him the all clear at 3.
Oh, really?
And
Okay.
all clear. Everything was, the adenoids maybe a little inflamed, but everything was fine. It's normal for your child to be sick 24/7, I guess,
Oh,
getting
goodness.
all the germs. Um, And I remember like even going through these courses and talking about the tossing and turning of kids sleeping, how that's a sign, or talking in their sleep as like all these
Mhm.
micro arousals in your sleep. And I can't tell you how many times, and we thought it was funny that I would go into his room and he would be in a different position on the floor sleeping. And I have pictures. I have pictures of him like under his bed and the sheets like tangled like Tarzan. I mean,
Yeah.
and it was never normal looking back.
Well, I even saw on Instagram someone had made like a reel of all the different things their child did during sleep that was supposed to be funny. And without
Mhm.
knowing, you do think it's funny because it's like, oh, well, how did this child do this in their sleep? But I couldn't have gotten them to do this when they were awake. And
Right.
we need to just really let the moms know to listen to their intuition. Like, hey, sometimes we laugh things off because we just don't know what to do. But really feel like,
Mhm.
oh, if you're laughing something off, then let's help you find someone that can help guide you. And so, what was
Yeah.
your first step with your son?
So I think it was during my first course in myofunctional therapy. I mean, I just knew he checked all of the boxes. And this was pre-COVID. So
Mhm.
he was scheduled to start palate expansion. So really trying to make his mouth bigger, trying to
Okay.
get better nasal hygiene, getting him breathing better. And at the time, our orthodontist was out of state. So then that kind of got put on hold because we couldn't travel out of state. So he started palate expansion again, I think almost a year ago.
Okay.
Now. And so now he has a beautiful wide palate, and he does great nasal hygiene.
Oh,
He is
wonderful.
sleeping better. There's still some things that I think are unresolved, probably. And I'm just thinking out loud that, from all of the years of poor sleep, not breathing well, have kind of snowballed. And now we have to unpeel his little onion a little bit more and get down to, really the fine root cause, because it's very overlapped things now that he's older versus when they're an infant. Just looking at these things is a little bit easier than unwinding a growing child.
Now, how was your labor with him?
So he was overdue. He was about 10 days overdue. He did not want to enter this world. He wasn't ready. And he was induced. So I think he got kind of pushed into the world a little bit fast. But otherwise, when he was born, I think everything was okay. Yeah. But I remember him he didn't stop crying for ever. And we laugh now.
Yes.
But he did not stop crying until he was 9 months old. My friends, even to this day, say he was either crying or you were breastfeeding.
I laugh because
breastfeeding.
I feel like we went through very, very similar where, yes, my son too, if he wasn't taking a very short nap because he never slept for very long, on the breast, on the bottle, because we went to bottle feeding as well. Because I would breastfeed, pump, while he drank a bottle. But yes, there was so much crying. And so I laughed because it's one of those uncomfortable things oh, I get it. I do. And when you go back to that, you're like, how did I get through that?
And I had so much postpartum depression as well that I think, that fourth trimester of pregnancy that we don't talk about enough. And I think it plays with your memory and that bonding time that you have with your child. I mean, while he was crying, I would put him in a wrap, put headphones in, and just walk because he wouldn't stop. And the pediatrician's like, this is colic. This is what happens. We don't know why, but we do know why.
That pediatrician just didn't know why. And
yeah, exactly.
Yes. And it's important that I remember not liking that term colic before I had my baby and thinking, well, that's just crud. If I told a patient, well, it's got to last for 3 months. How many hours a day? 9 hours a day of crying or something.
We topped it. So I don't even think we counted the hours.
And I'm like, what is that? And then it's a diagnosis with no treatment. And before I had our son, I'm like, well, that's just crud. I'm not going to have a colicky baby because that's crud. And then I had a baby that he never was diagnosed with colic because at 6 weeks we started with PT and there was still no diagnosis of things. But yeah, it's a lot. And did you get support for your postpartum?
Yes, I did. I eventually, it was such a cloud. It's so hard to describe. I don't know if you can describe postpartum unless you're a mom and you've just been through it. It's definitely this cloud that's just here. And eventually I do feel like the cloud parted and out I came into my own the way I used to be, but it took a long time. It took a long time for a lot of things to happen that should have never really happened.
Well, I remember when I went in for my 6-week follow-up and there's the questionnaire and I'm like, I don't have time for this. I don't have postpartum. I know what they're looking for. And so I answered the questions knowing that I wanted to get in and out of that visit. And I'm like, I don't want to talk about it. And I think it's for people that are very focused, I have all this to take care of at home. and thinking it's just a questionnaire. And then I was asked, oh, I see your questionnaire. Everything's good. And I said, yes. And I wish I would have taken the extra couple of minutes to talk and maybe get the proper referral so I could have gotten help during that time rather than later, similar to you as well. But I was so laser focused, and I really think it's because we didn't sleep, right? I mean,
Right.
your son
I
didn't
did
sleep,
not sleep.
so you didn't sleep.
No, he did not sleep. Oh my gosh, every position. I don't even think, yeah. And again, like that whole missing the memory thing, you're not sleeping
Mhm.
when you actually process your memories. So how are you supposed to process memories with your children if you're not sleeping?
Yeah, you never get
Right.
that restorative sleep. So I think right there, I think you defined when you're having some postpartum concerns, it's basically like just never being really tired all the time and being
Mhm.
so close to taking a nap, but
Yeah.
you don't get to. Right when I would
No.
fall asleep, and I remember there would be sometimes I would start to have dreams and then had to get up again.
And looking back, I think that, for my second, it was a little bit different. I had a little more education behind, still not, myofunctional therapy and tongue ties, but a little bit more information. And I felt more comfortable asking for help. So I didn't feel like I had to do everything myself. And that's how
Mhm.
I am as a person to this day. I have to do it myself. And it's taught me a lot, definitely, personally, professionally, that it's okay to ask for some help.
And I think that's such a key, especially, may no mama have, a baby with a tongue tie, but no matter what, I think that's the most important gift to give another mama is to let her know asking for help is really a sign of strength and not a sign of weakness. I feel very connected to that. I'm like, I can do it all myself. I've gotten through harder things than this. I can get through feeding this baby. I can do this.
Right. For something that's so natural, it's one of the hardest things I've ever done.
Yes. But yeah, you did it for 2 years with your first. And then how about your second?
He was close to 2 years too. He both boys kind of stopped on their own. I didn't force them to stop. They kind of stopped on their own. I think the little one stopped a little bit before, but he's a very busy child. So he had other things that he wanted to do. So he's going to be probably following in his brother's footsteps with some expansion and, different interventions. Tongue tie wise, I never had any pain nursing him, never had any pain. He nursed very well. He was that unicorn baby that you just put down and he'd go to sleep. I mean, it was like, was this really what it was supposed to be like? I don't understand. But he has incomplete R's, he has a list, he has definitely still some check marks that, we have to, why wait until he's 7 to do something when we can do it now. But my oldest Maddox, he's doing really well.
So he's done with the expansion now. And did he also have retraction or did he have
No,
lateral
so
expansion?
he has had, nope, he has, he's just finishing up his expansion, probably will be finished maybe in the next like 4 months total.
Okay.
And then we'll dive into more myofunctional therapy and getting his tongue tie released. He loves cranial sacral therapy. He'll go and just lay there.
Oh, that's great.
Yeah, he actually sees a child, not a psychiatrist, a therapist himself, because I do feel like still he harbors all of these emotions that were never released, and he's working through those. And it's amazing to see a mind that just works so well.
Oh, I agree. I mean,
really cool.
Him struggling to breathe in such a important time in his life.
Right.
And we might say, oh, it was just a year, but that's their first year of life where they're really learning everything about the world and their interactions, And so I fully agree that they can only handle so much. And he too was tired. You were tired. He was tired. And so some of that processing had to kind of be put on pause. And I really love learning about, unretained primary primitive reflexes that didn't get really, what's the term I'm looking for? Integrated.
Yeah.
And having that evaluated, I think I had 8 when I went. I had 8 unintegrated primitive reflexes. And he said, in a room that was full of physicians, there was not one that didn't have at least one, up to, I think he said tops was 12 unintegrated.
Wow.
Yes. So we can function, we can compensate, but let's not have to.
Right. Yeah. And for him, again, it's like, if I would have, would have, could have, here we are, we're doing what we need to do. I'm lucky that I know what I know who I know to know these things, but there are so many parents out there that still like think that the snoring is normal, or the baby's cheeks are so chubby, but the mouth is, hanging wide open, that's like so cute and normal. And I have so many baby pictures of Maddox with his big chubby face and his chubby butt and his mouth, all the sleeping pictures, mouth wide open. I just want to
butt up in the air.
Yeah.
Head back like that. Yes.
Yeah. All these like sleeping positions. And I have to, you have inspired me. I'm going to make like a Maddox photo album. I have so many pictures of his mouth open, the sleeping positions that I thought were funny. And now I just like can't catch my breath looking at them. Yeah.
Well, that would be great. Yes.
I got to do that.
That's the best way for others to really see it, because until that that's not normal, because it's so common. I like to share when I present, I'll go on Pixabay and try to find free pictures, or on Canva. And it can be really hard to find pictures of babies or kids with their lips together. And I'm like, oh my goodness. I'm like, wow. All these like I type in sleeping baby or baby restful, and I'm like, but I could get that. My son's pictures, I could just use those. I want like pictures of how a healthy baby is. And it's just become so incredibly common.
Yeah. And I think all of this has helped me in, the myofunctional therapy world. When I see a child that's, 7, 8, 9, and they have really a hard time getting through just a 20-minute therapy appointment because they're just in such a high sympathetic mode, really slowing down in working at them at the level that they're at is so important. And there's so much more than just getting to their tongue tie released. There's so much more that becomes evolved. And I have to, thank the mastermind program to really push me into, stopping and listening. And what did Sonda used to tell me? Shut up and just listen.
We were given 2 ears and 1 mouth for a reason.
Yes, just shut up and listen to them. And that's very true. It's very true.
Well, and that brings it back to when someone's in the dental chair, actually, too. I recall looking back at the most difficult patients. They weren't always the ones that came in. Like when you think of difficult patients, sometimes you can think of all kinds of different backgrounds. But the difficult patient was the one that really went in there and their tongue pushed you out. You went back in there and their tongue pushes you out. You're trying to do, whatever it is. And
the mentalis strain, you're trying to clean the lower front teeth and
yes. And you're like, no, and then you're pushing down more and they're pushing more against you. And,
and I used to tell them, just relax. And now I tell them, you need a myofunctional therapist.
It's the easiest way if you want like my cheat sheet of knowing whether or not to refer. So these are for dentists and dental hygienists. If you need to refer a patient to a myofunctional therapist, just think about if you're working on the second molars, if you can get back there, third molars if they have them, if you can get back there, oh my goodness, then most likely not. But if you can't even get to their first molars without problems, if you can't actually go anywhere around their upper or lower incisors. If they're pushing you out,
if they're, taking x-rays, like
yes.
their airways saying, nope, this is not working for me, get out of here. And then if you think about it, we have sprays and things. I know that I sometimes use these for patients that numb the back of the throat. We're just numbing their reflex to get something out of their airway. So they're probably still very uncomfortable. They're just a little bit numb, so it's easier for them. But
the salt that we put back there.
Salt, wiggle we have so many tricks in this field, but yeah. And even when you're cleaning, using a lot of the water, they always feel like they're choking on the water. Their tongue is not able to swallow properly and, brace the fluid. Obviously being on your back is sometimes a little difficult, but
yes. Once you're in practice, you know the difference between a child or an adult that is just a little bit nervous and calms down.
Right.
But then you'll notice if they're just consistently, they're really trying, they really want to try. And you're like, oh, I know you're trying. Those patients, just refer them right away, because your myofunctional therapist is going to be able to help. And then I know I'm a much better patient. I would work so hard to keeping my tongue still, but I would push them out. And now when I went and I got my gold inlay, I'm like, Tori, you just do what you need to do. I am good. She's like, really? I'm like, yeah, like rubber dams don't bother me. Nothing bothers me anymore.
Yeah.
Well, actually, so with that, how do you introduce that into your practice with your patients?
So I'm a clinical dental hygienist, just only 2 days a week. And the other days I'm seeing myofunctional therapy patients. Either it's still my own practice, but sometimes I bring them to the dental practice if I need to see them, especially the little ones. I like to literally be on the floor with them. People will walk by the treatment room and I'm laying on my belly and we're making faces in the mirror. It doesn't look like I'm doing anything, probably, but playing with a child. But we do sleep screenings. Every single patient gets a sleep screening when they come in the office. We have one tailored to children. We have one tailored to adults. They're two very different sleep screenings. We probably spend a solid 10 to 15 minutes on medical histories and reviewing the sleep screenings that we do. We kind of have some red flags that we check. High blood pressure, diabetes, things that can really be a sign of underlying sleep apnea. And then, obviously we do our dental exams and cleanings and whatever else they may need, but they do usually either get referred for myofunctional therapy, or we have a dentist that does some further TMJ, looking at that a little bit different. So they kind of get decided where we're sending them. Sometimes I do still find that the parents and patients are really unsure of why we're asking so many questions. So maybe that's why our medical history takes 15-20 minutes to get through. I really do need to know about all your medications. I do need to know about how you sleep. And, I can't count how many times I hear, well, I snore a little, but that's everybody does, right?
Yes, that's a very common thought. That it's just a little bit once in a while, but better than my bed partner here. And it's often compared. Well, no, let's not compare, because a little bit of snoring is still not good snoring.
Right. And I think you have to plant some seeds for patients to really, they have to take accountability for their own health at some point as well. So, you can only inform them of so much. And then, I have to say most of the time when they come back in 3 months or 6 months, oh, so what do I do now? Because they've thought about it. They've realized how much they're probably actually doing things that they didn't. I can't tell you how many patients tell me, oh, my tongue is up in the roof of the mouth. That's where it rests. And then we take a CBCT and the tongue is low in the mouth. And so I show them, look, your tongue really isn't there. So,
Well, I like to tell everyone, I thought everyone had mandibular tori, and I'll show them. So I have these huge bony protrusions on the bottom part of my mouth that I thought everybody had, because we only know what we know until I started working on patients. When I think I was 15, I was helping just check patients in my father's office. And I'm like, oh, so they don't all have these? Like, where's everybody else's? And so we think it goes up to the roof of our mouth because we don't know any different. And we don't know how to swallow. We don't know what it feels like to swallow properly until you actually get that release and you're like, oh, wow, I can feel it all the way back there and it's supposed to clear out my nose. That's amazing.
Yeah. I mean, we're giving toothbrush instructions, flossing, fluoride, non-fluoride products. We're going over all these things. And then we're also going over nasal hygiene. You brush your teeth at night, just wash your nose. This is how you do it. Next time, if you want, come in 5 minutes earlier. We'll squirt our noses together. Because it is weird. People don't think that they should just wash their nose, but just wash your nose.
Well, I think it's wonderful that you've gotten yourself with another provider. You shared with me earlier that in upstate New York, which I like to let people know because people will be listening all across the country, that it's not just wherever you might live. Everywhere we are in need of providers. And Laael is in upstate New York, and you were having to drive a fair amount to get your son's expander. Is that correct? You were saying out of state. And
I drove out of state. I have since found closer providers, but at the time, his main provider now is about 6 hours away. But we're kind of like shadowing the case myself in our practice. So I'm not driving there all the time. But yeah, the initial was a couple hours. Even, where I am, it's still hard to get children tongue tie releases, to get children orthodontics. The collaboration is happening. I'm really proud of this area that they're starting to do these things. But as you know, when you learn something and you just want to like attack everything possible, you're like, where are all my people? My people aren't here. I had to go to California to find some of my people.
And so I feel like that's very important, because sometimes we get so used to things being convenience based that really, if you have a provider that is less than an hour away from you, that's phenomenal. And it's going to get better. Be patient. But a lot of people that will drive to me, they've driven, 45 minutes or so. Well, that's really not bad, because this has been a really hard thing to really change in orthodontics, for people to not just look at the crooked teeth as being the problem. And I'm like, so really 45 minutes, some people have to drive, like you said, 6 hours to get this. And it's a reminder that it's not just in Indiana where I am. It's not just in New York.
No, it's
providers are needed everywhere. And that's part of the reason why, you're part of the Breathe Institute. You helped get Airway Circle really out there, so more people could collaborate and could have the directory, so more listeners could look for practitioners closer to them. And it's going to get better. When we do this again in about another year or so, we'll be like, oh, remember that? And now there's so many more, which is great, but also be patient.
Be patient. Yeah. I mean, I think I had somebody travel 3 hours with their little one because I didn't want to see the little one on the computer. Telehealth is great, but I wanted them in person. And now I saw them once. I kind of gave them a good baseline. And now we're working virtually. The speech pathologist that's doing the heavy lifting is on one end. I'm on the computer, but we're collaborating 3 hours away. So things can work. You have to just think outside your box, be creative. And this little pumpkin is doing just fine. But again, it took driving 3 hours, collaboration with the speech pathologist, and finding an ENT. So it took a lot. And I think we're used to instant gratification.
Yes.
We just want everything to change so quickly. Even for myself, my son, I'm like, gosh, he's been in orthodontics forever. No, he's been in it for like 10 months. It's not that long. I just want it over. I want him to be fixed and feel good. And, it's baby steps. It's those onion peels, that progress that you make.
Exactly. Do you have any other wisdom that you'd like to share with other mamas?
Other wisdom. I think you have to, especially if it's your first, go into everything with no expectations. What everything looks like. I think we're very social media driven society, and sometimes we get very influenced by what we see and what's really reality. And I know that I have a surrounding of moms that have reached out to me for their babies. I don't treat babies right now, but they've reached out, and I don't even charge to see them because I just feel like they need somebody. So I think you have to find your somebody that makes you feel like you're a part of something as a mother. You don't have to be in this field as a mother, and rely on those people to help you. You know, you don't have to stop just because the first lactation specialist hooked you up and said you were okay. If you didn't match up, it's okay to move on. It's just like there's a million dentists out there. It's okay to switch dentists to find somebody that aligns with your energy, your field. You don't have to stay with the same person.
Well, that's wonderful.
Yeah.
Pediatricians too, yes.
Yes.
Well, with that too, going back to your sharing the struggle of taking care of yourself, that is part of why Take 3 from Me was co-created between me and my acupuncturist Bree Grish. And Laael has agreed that she will participate with that. We end each podcast with that as a reminder that you've taken the time to listen to this to get, more information about your health, your child's health, but also keep in mind that our mental health is part of our overall health, and we deserve 3 minutes a day for ourselves. We won't do the full 3 minutes here. It's a 3-step program. It's Take 3 from Me. And ideally it's 1 minute of gentle movement, which is typically, actually it's a myofunctional therapy exercise typically that we kind of put under the face yoga. More people know face yoga, but really, if you look at face yoga and then you look at the exercises that Laael is teaching you, you're going to say, oh, those are really very similar. They might have different names. So that's where we got that aspect of it to help tone our face, because we forget that our face is actually just a bunch of muscle. And then the second part is our mindset reset, where we challenge you to look at what you are grateful for, what you are proud of yourself for, and your intention for the day. And then lastly, your breath work, really trying to pay attention to how your breath is, if it's short and shallow, or if it's nice and deep and calm, and just really connecting your mind and body through the breath. So if you've been driving, just kind of wiggle around in your car a little bit. Laael and I have been sitting. So step 1, just kind of move around. Yep, move your shoulders. That's a great one. Oh, thank you. Yes. Did you work this morning over patients?
I should send this to my physical therapist. Look, I'm doing my exercise.
Oh, yes. And this feels so good after a day of being hunched over. Oh, this is wonderful. Okay. So do whatever feels good to you. And now next, our mindset reset. So Laael, would you like to share all 3, or did you have just 1 or 2 you'd like to share of what are you proud of, grateful for, and your intention?
I'm proud of. I am proud that in a field that can be lonely, that I've made so many beautiful connections through all different, backgrounds of people. And then what was the next one?
What you're grateful for?
Grateful. I am grateful for the fact that I've been able to bring my son to the point where he is now from where he came from.
That's awesome. And then do you have an intention for today?
My intention is to enjoy, we have sunshine today. My intention is to enjoy the sunshine and my son's baseball game later. T-ball. It's very exciting.
Oh, good.
That's my intention. It's a great rest of the day.
Well, that's wonderful. And it's always nice to be outside with family. And so may you guys have a wonderful T-ball game.
Thank you.
Well, thank you so much for taking time to talk with me today. And I would like all of our listeners to be sure to subscribe so you can listen to next month's guest, which is Lisa Leahy. And Lisa's experience ranges from working with patients as an IBCLC, registered nurse, orofacial myofunctional therapist, and now family nurse practitioner, and founder of the Oh Baby Spa in Indianapolis, Indiana. Lisa is also a contributing author to the book Tongue Tied by Dr. Richard Baxter. So please share this podcast if you have found that this content would resonate with others. And until next time, enjoy all those moments of motherhood that are magical.